Periodontal disease, also referred to as gingivitis, impacts millions of people across the globe. It's a very common, but severe condition that can result in tooth loss when neglected. However, there are many treatments available to help restore dental health and stop the possibility of further damage. In this short video, we'll go over some best procedures for treating periodontal problems and their advantages. Scaling and root planing. It's a non-surgical treatment that requires a thorough cleaning of the gums and teeth in order to get rid of tartar and plaque buildup. Dentists use specific tools to eliminate the bacteria as well as smooth the root surfaces of the teeth in order to stop further infection. The root planing procedure can be the very first stage in the treatment of periodontal problems and could reduce the need for additional painful treatments. Gum grafting. If the gum tissue receding because of periodontal diseases, and graft of gum may be needed to mend your gum line. This process involves taking tissue from another region of the mouth or from the donor site, then attaching it to the damaged area. Gum grafting may help to keep the roots of teeth and enhance the appearance and overall look of your smile. Procedure to reduce the size of pockets. When periodontal illness has advanced until pockets have developed between gums and teeth, then treatment for pocket reduction might be needed. The dentist will remove pockets and smooth out the dental roots in order to stop further infection. This procedure may help to lessen inflammation and encourage the development of gum tissue that is healthy. Bone grafting is a procedure used in severe periods of periodontal diseases. The bone that holds teeth could become damaged or weakening. The procedure involves re-establishing the missing bone tissue using synthetic or natural bone materials for support of teeth and restore facial shape. This treatment can in preventing tooth loss and increase the dental stability. Laser therapy. Laser therapy is a low-risk procedure using a laser to eradicate infected tissue as well as germs from the gums. The treatment is able to alleviate inflammation and encourage expansion of healthy gum tissues. Laser therapy is typically employed as a complement to other procedures for improving general gum health. Maintenance. Once the periodontal therapy is completed, it's crucial to maintain an excellent oral hygiene routine to stop the development of gum infection. It includes regular brushing and flossing, as well as periodic dental checks as well as cleanings. Dental professionals may recommend particular mouthwashes and treatments to assist in the prevention of recurrent infections. As a result, periodontal illness is common, yet treatable problem that can be successfully controlled with the proper methods. When you seek treatment at an early stage and heeding the suggestions of your dentist, it can improve your gum health and stop further damage from occurring. If you're suffering from symptoms of gum disease, for example, bleeding gums or a bad breath smell, don't delay in scheduling a dental appointment to undergo an exam. Dental health is crucial as well, and by taking the proper dental care, you'll enjoy an entire lifetime of healthy teeth.